Hi, I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas. In this video, I'm going to talk about the metabolic syndrome, a recently recognized medical disease which occurs many years before the development of diabetes. For the past 20 years, we have realized that in the vast majority of patients with diabetes, the problem is not a lack of insulin, but rather a problem with the body's reduced sensitivity to insulin. In other words, it takes higher amounts of insulin to adequately lower blood sugar. This type of diabetes is called adult onset diabetes. Adult onset diabetes is associated with high blood pressure, low HDL cholesterol levels, high triglycerides, excess weight, and having relatives with diabetes. What we have discovered in the past 10 years is that long before people develop diabetes, they have certain abnormalities that in aggregate are called the metabolic syndrome. These abnormalities include increase in waist size, 40 inches for men and 36 inches for women, having high blood pressure, greater than 135/85, having triglyceride levels above 200 points, and having an HDL cholesterol less than 40, and having a family member with diabetes. By definition, patients with the metabolic syndrome have normal blood glucose levels. However, when patients with the metabolic syndrome are followed for 10 years, almost 80% develop diabetes. Patients with diabetes are 2 to 4 times more likely than non-diabetics to develop heart attacks and strokes. Patients with the metabolic syndrome have a heart attack and stroke rate that is almost as high. It is therefore very important to diagnose and treat the metabolic syndrome. The fundamental problem with the metabolic syndrome is insulin resistance. The best ways to treat the metabolic syndrome are weight loss, regular exercise, and drug therapy. There are several drugs used to improve the metabolic syndrome, including angiotensin-converting enzyme inhibitors, or ACE inhibitors, angiotensin receptor blockers, or ARBs, statins, which are powerful cholesterol-lowering medications, and certain medications used to treat diabetes. There are 3 medications that are used to treat diabetes and work by improving insulin resistance. They are Metformin, also known as Glucophage, Rosiglitazone, also known as Avandia, and pioglitazone, also known as Actos. Weight loss is extremely important. The major ways to help lower weight are to reduce the amount of fat and sugar in the diet and to perform regular exercise. Walking is probably the best way to exercise to lose weight. Walking 30 minutes a day at a comfortable pace will result in an average weight loss of 10 pounds over a 6-month period of time. The best time to walk is first thing in the morning. The reason for walking first thing in the morning is simple. It gets done. Most people are too tired at the end of the workday to walk, hence it doesn't get done. The second reason for walking first thing in the morning is that in San Antonio it's too hot to walk in the afternoon or evening for much of the year. Metformin, Rosiglitazone, and pioglitazone are the 3 medications that improve insulin resistance. When they are taken by patients with the metabolic syndrome, there are usually vast improvements in cholesterol and triglyceride levels. In addition, the HDL cholesterol level frequently improves. One of the most important aspects of Rosiglitazone and pioglitazone is that in addition to improving cholesterol levels, is that they also prevent the development of diabetes. For these reasons, we often use the medications that are normally used to treat diabetes in people that don't have diabetes but who have the metabolic syndrome and are at high risk for developing diabetes. In summary, the metabolic syndrome is a pre-diabetic condition characterized by increased weight, high blood pressure, low HDL cholesterol, high triglycerides, and a family history of diabetes. The fundamental problem is insulin resistance and its associated substantial increase in the risk of heart attack and stroke. Therapy includes diet, exercise, weight loss, and medications. Some of the medications used to treat the metabolic syndrome are standard medications for diabetes. For information about the importance of ACE inhibitors, ARBs, and statins in the metabolic syndrome, please review the educational videos on altase and HMG coenzyme A reductase inhibitors. I hope this educational program has helped you understand the metabolic syndrome and why we may be prescribing medications that are used to treat diabetes even though you don't have diabetes. I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas.